Your specialty is this interesting mix of talking, listening, helping people decide, providing options, administering options, probably consulting, I assume, with family and the patient in some situations, and the doctors, the primary care doctors. It must be it's a somewhat complex job. But my first thought, hearing about it, is it's a depressing job because pretty much you don't save anybody. They're all going to die. So is it a depressing job?
No, it's actually, it's not depressing at all. A lot of people ask me that. And, I'll say when I give talks to med students and residents, I haven't helped anyone really live a lot longer in 10 years, but it doesn't mean that my job is sad and depressing. I have a lot, because of my training, I have a lot of skills in communication. And I think that one of the really depressing things for a lot of physicians when they're trying to talk to patients about the end of life is it doesn't go well.
Yeah.
An oncologist will say something like, well, your cancer is really getting worse. You can't breathe now, and your lungs are full of fluid, and, you can't even get up to go to the bathroom. And so I think we really need to start focusing on keeping you comfortable. And some patients and families will become very angry, and they'll say, well, what do you mean? Like, isn't there more that you can do? And then the oncologist will say, well, no, there's nothing more I can do. And we can talk about why that's, not a very good approach. But when, I have a lot of training in, communication and psychology and how to kind of help patients and families accept limited prognosis, understand what their choices are in a way that doesn't focus on abandonment and doesn't focus on
despair.
I'm sorry, what?
Despair.
Yeah, despair. I'll talk a lot about there's a lot that we can hope for. We can hope that, you can make it till your son's graduation next month. We can try to help your breathing get better. We can help your pain get better. But we have to prepare in case things change in the future. And, I also work as a hospitalist. I mean, I am an internal medicine doctor, but I, up until recently took care of regular hospitalized patients. And a lot of times you're doing things that are uncomfortable. You're putting in big central lines in people's necks. You're sending them for MRIs where they have to sit in a tube for an hour. You're, putting needles in their back to take spinal fluid out. And it's painful. And with my job, I just get to help people feel better. So, and you get to learn about, people. You get to learn about their life. I mean, I was a history major in college, so I find people very interesting. That's why I like your podcast a lot. I learn a lot about different, people's history, their past, what, their family life, how they haven't talked to their daughter in 20 years, but, we're going to help them get back in touch with her before she dies. I mean, can be very, very uplifting.
That must be extraordinary. And there must be some days that are very moving and uplifting like that. But there must be some tougher ones too.
Yeah, I mean, I think when it's really hard when people don't, when they're in denial, and denial can be a protective thing. I'll tell the residents that you don't want to just sort of break down someone's denial, but you want to kind of help them move along. And sometimes you'll just see patients who are going to die and they're not accepting it, and so you see them suffer a lot. Get a lot of life support treatment and things that are not going to help them, and make choices that you don't agree with. But it's a free country. We don't live in a totalitarian state, so you have to accept that even with the best communication, some patients will make choices that you don't think are good.
Well, let me ask